Hey guys, welcome back to Kestner Health and Wellness TV. The past few weeks we've been talking about migraines. First we talked about what is a migraine, then we talked about the triggers of migraines, and then we talked about the physical component and what we do in this office to actually correct and really help our patients get rid of those migraines. Now I want to talk about a patient, and he had been to multiple doctors and been to some acupuncturists and done massage, and that those are good things, but he really was just having a hard time, with migraines and actually getting rid of those. So he came into our office and we took some x-rays of him and got down to the actual source or the cause of those problems. So this is his first x-ray, and if you look at this, he's actually at a negative 11 in the bottom portion of his spine. And in the upper portion, he was actually at a positive 20. And being at a negative 11, the normal position of the spine should be anywhere from 43 to 45 degrees. And he was actually, again, at a negative 11 here. And he also had forward head posture. So what we did with him that day was we took that x-ray and then we worked on him and we took a second x-ray of him. And the type of care that we do in this office is what's called corrective care. So we're not really comparing apples to apples here, but what you're looking at is on the second film, we use head weights and then we use this apparatus around the neck, because after they get adjusted, one thing we want to happen is we want the structure, the change that we just made, to hold. So after the patient in our office gets adjusted, they do therapy exercises to get those muscles to hold so that bone doesn't slip back out of alignment and put pressure on those nerves. This area of the spine is so key and vital because there's a lot of pain receptors in those areas. And then when the spine begins to misalign, what ends up happening is the muscles get really tight, and that can lead to tension headaches as well. And then this was some visits later, we took another x-ray, and as you can see here, this is his post film, and it's at actual 36 degrees. So now all of his headaches are gone, he's off all his medications, and now his body is functioning and healing at a higher level. And when we talk about headaches, and again, in the past we've talked about the triggers, it's real important to understand that the body's mainly made up of water. And a lot of times what we see with headaches is dehydration. So the body again is made up roughly around 70% water, so it's very key and vital that we're staying hydrated. A headache is it's decreased oxygen to the brain, and oxygen travels in blood, and the way blood gets back to the brain is through a vertebral artery. And if you have lack of oxygen, then that can end up with a headache as well. I'm actually in my workout gear today, so typically the past videos you've seen me in a sweater or what I typically wear to the office, but exercise is also key to preventing headaches, because when you're exercising, you're getting a lot of oxygen in. So now he's applied all this to his life, and now he's preventing headaches in the future, because number one, he understands what headaches are, he understands what causes them, and now we've got to the root of the problem and fix that, so now he doesn't end up back there. With that said, if that's something you want to take advantage of, give us a call here at the office at 615-646-6700.